Thank you for choosing Axxess On Demand. We're the fastest growing home health technology company, helping improve care for more than 1.5 million patients and trusted by more than 7,000 healthcare organizations to grow their business. Axxess is a firm believer in continuing training, and we create content so you can learn and grow anywhere, anytime. Let's get started.
Hello, my name is Tamara Brown. I am a registered nurse and have several years of home health experience, both in the clinical and administrative aspects. I am presenting an overview today on the most significant changes to OASIS-C2 that Medicare has put out for calendar year 2017, and these went into effect on January 1st, 2017. First, I'm going to log in, and we're going to start with one of the new questions. M1028 you're going to find on the patient history and diagnosis section. It's going to be down close to the bottom of the screen. And this isn't technically an assessment question. This is a documentation question. What this question is asking is if the patient has active diagnosis of either peripheral vascular disease or peripheral artery disease, and also asking if the patient has an active diagnosis of diabetes mellitus. Now, the patient can have one of the PVD or PAD diagnosis or a diabetes mellitus diagnosis, or they can have both. If they have both, you would check both boxes. If you answer in the affirmative to either, then in the diagnosis coding section, there needs to be a corresponding diagnosis for one of those comorbidities or coexisting conditions. So this is not technically an assessment question. This is a comorbidity coexisting conditions question, and there has to be corresponding diagnosis in the assessment that relate to those questions. And it does need to be in the top 6 in terms of the validation system that Axxess uses. So if you run the OASIS scrubber from Check for Errors, it won't come up as an error in this section. It will show up on the OASIS scrubber. So please note, you won't see it as an error in the Check for Errors screen like this 1306 or 1311, but it will come up as a possible coding violation on the OASIS scrubber. Does it mean that you've done it incorrectly? It just means it's looking in the top 6 diagnosis. If you do have one of the diagnoses on the assessment and it's not in the top 6, you are covered in that regard. It will still be proper documentation. The other new question is also on the patient history and diagnosis page, and it's up closer to the top, M1060. This is the height and weight section. Now, previously, we always had a section for height and weight, but they were not required documentation in terms of OASIS. Now they are. Bear in mind, this is only on SOC or resumption of care. You will still see this section on other OASIS documents, but it will be similar to the regular vital signs section. It will not have an M number, and it will not be an M question in terms of validation. Medicare instructions are that this needs to be recorded in inches, not feet and height. So for this patient who is 67 inches, that is 5 feet 7. You'll notice you can no longer put that tick mark to indicate feet. And if you put the 7 and try to put the double quotes for inches, that will not work. You have to put this entirely in inches. Now, the other thing to note is they use mathematical rounding for this. So if the patient's height is 5 feet 6.5 inches, you would round up to 5 feet 7 and then convert that into inches, but would be entered as 67 inches. There are situations where you would be able to use a dash in this box, but there are very, very special situations in which perhaps the patient is discharged or transferred to the hospital or dies before the assessment item could be completed, and those are unexpected. That's the only time in which you would put dashes in there. So you can't put it in just because perhaps the information wasn't available or you didn't have a tool to measure the patient with. There has to be some special situation in which you do not put that information. So for that information, you would just check height not assessed or no information available, and you'll see it automatically populates those dashes for you. You won't be able to type that dash in, but it will populate it should you check the box. That rounding rule also applies to weight. If the patient's weight is 0.5, you would round up to the next number. So if perhaps the patient's weight is 145.5, you would round up to 146. Now, if the patient's weight is 145.4, you would round down to 145. So just make sure to round appropriately. There are some wording changes. These are not significant changes in terms of numbering or required information, but there are wording changes. 2 of those occur on the integumentary status section, on the start of care, and on the discharge. You'll notice on the C2, we now have a 1311. This was previously 1308. Another thing to note on this page, there is a change in the numbering system. Last year, the National Pressure Ulcer Advisory Panel changed to Arabic numerals. So you'll see that we no longer have Roman numerals, we have the standard number 1, number 2. So they're not using the Roman numerals anymore. Let me go ahead and show you that discharge as I mentioned a while ago. Again, we're using Arabic numerals, not the Roman numerals. We used to have a 1309 and it is now 1313, worsening in pressure ulcer status. And this also has the changes in the numbering. And also note that the look back is now at most recent SOC, ROC. If we look at the OASIS-C1 discharge, and we had Roman numerals, and now they are the Arabic numerals. Another change is in the cardiac assessment questions. So on a C1, cardiac assessment questions were 1500, and if you answered yes to 1500, then you received the question 1510. Now on the OASIS-C1, the look back was since the previous OASIS assessment. There is now a change to that. On a C2, 1500 is now 1501, and it specifically asks since the most recent SOC or ROC, start of care or resumption of care. Additionally, 1510 is now 1511. It also has the look back of most recent SOC or ROC. So bear in mind there is some slight changes there, but they are significant, and it is no longer asking since the most recent OASIS, it's asking since the most recent SOC or ROC. The next significant change is under the ADLs, IADLs section, and that is going to be the start of care. It is not on the discharge. Under the ADLs, IADLs, there is a new section. It is now GG0170C. It is the mobility section. This is not asking about the patient's willingness or adherence. It is actually looking at the patient's ability. This has to be thoroughly tested, I guess you would say, to determine the patient's actual ability. They may not want to do certain things, but based on your observance of the patient's mobility and other aspects, you might be able to infer how to assess this. There is a significant description of this question under the question mark here, so if you need some further guidance, we have quite a bit of information here. But again, this is not assessing the patient's willingness, this is actually assessing the patient's ability. And sometimes ability can be temporarily or permanently limited, but you have to do the best to get the actual ability at the time of this assessment. And then the last minor change is under the discharge transfer and transfer with discharge. So under a C1 on emergent care, we had question 2300. This is a small change again where it's talking about since the previous OASIS assessment. Now on a C2, it is asking since the most recent SOC or ROC. So again, it's a small but significant change. It is not asking since the most recent OASIS assessment, it is asking since the most recent start of care or resumption of care. 2301 is the new number for that question. It was previously 2300. Also on the OASIS-C1 discharge, we had question 2400. Again, slight change. The wording since the previous OASIS assessment on the C2 is now since the most recent start of care or resumption of care. Slight numbering change from 2400 to 2401. Thank you for watching this OASIS-C2 overview. I hope this has helped you in understanding some of the changes and how to complete some of the new sections of the OASIS-C2. And if you do need any further assistance, here under the Help tab, you'll see we have a link to our training and our Help Center, and we have quite a bit of information available here. I appreciate you taking the time to watch this video, and I hope you have a good day.
Thank you for joining our on-demand training today and for choosing Axxess, a provider of innovative, cloud-based software, services, and solutions to help home health organizations improve patient care and grow their business. Axxess is the only healthcare technology company approved to award continuing education credits by the American Nurses Credentialing Center and is also the most recommended home health software on Software Advice. You can watch more on-demand training videos through our software or at axxess.com, where you can also find tutorials, blogs, white papers, and answers to frequently asked questions. Thanks again for choosing Axxess.